Hello, this is Dr. Gray, and today we're going to talk about a drug-free approach to treating learning and behavioral problems in children. Children are a source of happiness, laughter, and love, and children are our future. This is nothing less at stake here than our very future itself. Yet by 1975, 150,000 American children were being drugged to treat a little-known condition called hyperactivity disorder. By 1997, that number had skyrocketed from 150,000 to 4.4 million. Today, there are an estimated 6 million children in the U.S., quote, diagnosed with attention deficit hyperactivity disorder, taking powerful psychiatric drugs for a disease, quote, that may not even exist. So, is attention deficit hyperactivity disorder really a disease? Or is it just symptoms with various causes? Some quiet symptoms of learning disorders are making frequent mistakes, failing to pay attention to details, not listening when spoken to, losing things, forgetfulness, easy distractibility, etc. Types of active symptoms are fidgeting, squirming, talking incessantly, blurting out answers, etc. As all of us were children once too, we have all experienced or demonstrated these quote-unquote symptoms. Yet parents are often told that their children need to be put on Ritalin, Adderall, or any number of other drugs in an attempt to quickly, quote, cure their hyperactivity. Drugs are recommended and often suggested to help scholastic achievement, yet according to the U.S. Drug Enforcement Administration, they said that a review of 17 studies using 55 independent measures of academic achievements showed that psychostimulants such as Adderall and Ritalin have no long-term beneficial effects on scholastic success. Again, that's no long-term beneficial effects on scholastic success. So, quote, learning disorders are manifestations of symptoms that may be traceable to irritation or malfunction of the central nervous system. When balance is restored to this system, the symptoms improve. There are a variety of ways to accomplish this. Natural therapies support the body's innate ability to heal itself. According to research by Esteban Janot, a medical doctor, they say that hyperactivity can be a sign of toxicity or nutritional deficiency, and in most cases both. Research done by Dr. Olarsh links hyperactivity, learning problems, and violent behavior to fundamental lack of minerals. Symptoms of mineral deficiency can include nervous system dysfunction, memory loss, hyperactivity, restlessness, confusion, depression, irritability, poor coordination, insomnia, fatigue, nervousness, and much more. Environmental factors that can also trigger hyperactive symptoms are chlorine in the water, chemicals in furnishings, decorating products, cleaning products, insect repellents, and pesticides, dust, mold, aerosol disinfectants, school air, and pollen. Children who are having reactions to food and or environmental allergens run the risk of being falsely and incorrectly labeled with a learning disorder. There are two possible approaches to treating a child with learning and behavioral symptoms. Drugs such as Ritalin, Adderall, Cylert, Dexedrine, Syban, Luvox, Zoloft, or a drug-free approach by removing irritants to the nervous system. The most commonly prescribed drug to treat so-called learning disorders is Ritalin, now being replaced with Adderall. Ritalin has been classified as a Schedule II drug, just the same as cocaine, by the Food and Drug Administration. A 2002 study estimates that as many as 10% of all school-age children have, quote, ADHD, and that your child has a 7.5% chance of being diagnosed as having ADHD by the time they graduate from high school. However, in a landmark decision, the Colorado State Board of Education passed a resolution that recognizes that, quote, there are documented incidences of highly negative consequences in which psychiatric prescription drugs have been utilized for what are essentially problems of discipline, which may be related to a lack of academic success. And their resolve to encourage school personnel to use proven academic and or classroom management solutions to resolve behavior, attention, and learning difficulties. Is a learning disorder a chemical imbalance? Enthusiasts for drug treatment claim hyperactivity children is a biochemical imbalance. T.J. Moore of George Washington University's Health Policy Center disputes this idea. He says the chemical imbalance theory has not been established by scientific evidence. Pediatric neurologist Fred Bogum, MD, wrote to several government agencies requesting that they, quote, refer me to the one or few articles of peer-reviewed journals that constitute proof that ADHD is a disease. In response to this, the Food and Drug Administration stated, quote, no distinctive pathophysiology has been delineated, which means that they have no idea what causes these symptoms. In response, the U.S. Drug Enforcement Administration replied, quote, we are unaware that ADHD has been validated, end quote. In response to this, the National Institute of Mental Health confessed, quote, we have not yet met the burden of demonstrating specific pathophysiology, end quote. Is ADHD a real disease? The National Institute of Mental Health does not have an official position on whether ADHD is a neurobiological disorder. Just as there are causes of a cough, which could be anything, it can cause the flu, it can be caused by bronchitis, it can be caused by tuberculosis. There are many different things to cause symptoms in your body. Just like there are causes of learning problems, such as inattention, distractibility, hyperactivity, impulsiveness. It could be from a nutritional deficiency, nerve irritation, a medical condition such as a thyroid problem or diabetes. The National Institute of Mental Health admitted that their 1998 consensus development conference on the diagnosis and treatment of ADHD, they said, quote, we don't have an independent, valid test for ADHD. There are no data to indicate that ADHD is due to a brain malfunction. Existing studies come to conflicting conclusions, end quote. So they don't know what causes this. They can't even tell you what ADHD is. There's no way to diagnose this. They also say, quote, use of psychostimulants increases or decreases the risk of abuse. And finally, after years of clinical research and experience with ADHD, our knowledge about the cause or causes of ADHD remains speculative, end quote. The group Children and Adults with Attention Deficit Disorder, also known as CHADD, was partially funded by Ciba Geigy, now called Novartis, which is the drug company that makes Ritalin. In the 1990s, CHADD lobbied to make Ritalin non-prescription.